Okay.
Okay, well, hello everybody. Good evening, Norwalk, and welcome to my second town hall meeting. We'll be here for about 45 minutes to give an update on the local situation and answer any questions that we may. I know many of our Common Council members are tuned in as well, so thank you for joining us. They've always been on top of things, and we're working closely together to make sure that we're doing the right things for Norwalk. This week, I'm happy to be joined by my Health Director, Deanna Diamore, and the Chief of Community Services, Lamont Daniels. They'll each give you an update from their respective areas and what is happening in Norwalk before we open it up for questions and answers. Just some housekeeping notes so you'll know. If you have questions, type in your questions by hitting the Q&A button at the bottom of your screen. We'll do our best to answer as many questions as we possibly can. As I said, we'll be here for about 45 minutes. If you have a question or concern that you wish to address privately, please email me. My email is hrilling, R-I-L-L-I-N-G, at norwalkct.org. And feel free to enter your questions now during our brief updates, and we'll get to the questions and answers in a few minutes. So some recent updates from the city side. Although City Hall is currently closed to the public, we have a lot of staff that are still working. They will respond to calls and emails as soon as they possibly can. However, it is challenging because we are on limited staff and limited time. So be patient. It might take a little longer than usual to answer your questions. We've been thoughtful about how we schedule operations and staff. We wanted to make sure that we have as many employees available as possible, but also we need to limit the exposure to the coronavirus. So we have some staggered staffing going on. It seems to be working well, and it seems lately that the exposure level is down. So as I say, it might result in a delay in services or responses, and we certainly do appreciate your patience and understanding during this time. You know, one of these things that we've always talked about during the coronavirus situation is that we have to make some very, very difficult decisions. Difficult decisions regarding on what businesses to allow open, which to remain closed, what kinds of social distancing protocols we would wish to put in place. The other thing that we have to do is decide what events that you're used to having that we may not be able to have this year. So far this year, you know, the Memorial Day Parade has been canceled. We hopefully will find a way to honor our military men and women who lost their lives in the line of duty. You know that Norwalk does it better than anybody else, and we want to continue that tradition. We want to make sure that we don't lose sight of the Memorial Day holiday ceremony and make sure that we do it right. We also have decided that we will be canceling the 4th of July fireworks. I know this will be a disappointment to many, including your families, your children, but usually we have in excess of 20,000 people crowding into the beach to watch the fireworks, and it's usually a festive event. It's really enjoyable, and everybody has a great time. This year, we felt that having 20,000 people congregate in the small confines of Calf Pasture Beach and Shady Beach would be irresponsible. So we have decided to cancel our fireworks. We're going to be looking at some of the other things. Hopefully some of the other events that we have during the year will be able to continue based on the situation at any given time. So as I said, my team has been charged with putting together a transition plan or a proposal where we can start thinking about moving back to some degree of normalcy. We know that the normal that we knew will probably never be the same again, but we're looking to move back to some degree of normalcy by easing some of the restrictions we have in place. And we've put that charge on them so they can give me some ideas as to when we can start opening things again. It'll be situational rather than a specific date, for instance. So we want to know when it's going to be safe to reopen the beach and some of the playgrounds, when it'll be safe to open the boat launch permanently. So this past weekend, we did on Saturday and Sunday open the boat launch for Norwalk residents who wish to have their boats in the water and put it over at their marina slip. It was by appointment only, and everything went really, really well. The Yardway site is open this week for residents again. No weekend hours available at this time, but they'll be available during the week, and you can get that information on our website. We will be doing yard waste collection based on when you have your garbage collection. So please keep your eye on that as well. Look on the website also. So my team is working on scaled reopening plan for Norwalk. We can only gradually reintroduce services. This will be dictated by the medical experts. I know that we hear different places that may be opening, different states, different cities, large cities, but we need to be cautious. We've come so far in the past 5 weeks. We've accomplished a downward trend of the spread of the virus, and we want to see that that continues. So we feel by rushing into reopening and getting back to what we consider normal too quickly may have catastrophic consequences. It happened during the 1918 Spanish flu. It's happened in the past where people want to rush, and we understand nobody is any more frustrated than we are in the city. We understand your pain, we understand the suffering, we understand how difficult it is to maintain social distancing, to stay at home, etc. But we want to do it right. So we're going to be listening to the medical experts to determine when we feel it's going to be safe to start easing some of these restrictions. One of the greatest responsibilities, or the most important responsibility I have as your mayor, is to keep our community safe. And I take that responsibility very, very seriously. So while some people may not be pleased about how we're approaching this, we're doing the best we can with the medical advice that we get. So again, thank you for your patience, Norwalk. But I know that at the top of everyone's mind is health and what the situation is in Norwalk. And that's why I've asked our health director to join us tonight. So Deanna Diamore, if you would give us an update from your area. Thank you.
Sure, thank you, Mayor. Good evening, everyone. Good evening, Norwalk. We have nearly 1,500 positive cases in Norwalk of COVID-19, and 70 of our residents have died. We may be just past the peak of COVID-19. We see the positive cases are declining. The hospitalizations are trending down, as the mayor has said, and so we're really hopeful that we are past that peak. But we know that it's important not to relax the guidelines right now because we still don't know how many people have the virus unknowingly, asymptomatic. And if we relax things too soon, we could see the cases and hospitalizations increase again. So I just want to also thank you all, just as the mayor has done, for all that you are doing, all the sacrifices you're making. Every time you stay home, every time you wear a face covering in public, every time you wash your hands, all of that matters, all of that makes a difference. And so we really, really appreciative of everything that you are doing. One of the questions we do get sometimes is, comparing this to a flu. And so I just wanted to point out that, the reason why we have to rely on these physical distancing measures is because we don't have a vaccine. We've never seen this before. It's a brand new virus. And so, the immunity isn't there like we could see in some of the with a flu. So just to give you some comparison, during the 2017-18 flu season, which was one of the highest, we had seen it over the past decade, there were 184 people that died from the flu in Connecticut. And as I've said, we've had 70 just in Norwalk alone this year of COVID-19. There have been 10,529 confirmed cases in Fairfield County of COVID-19, and during the 2017-18 flu season, there were, just under 4,000 laboratory confirmed flu cases. So we're seeing this in a much greater impact, and that's why we have to rely on these physical distancing measures. We know we've been reporting every day on new cases in Norwalk. We've been providing that information. The mayor has been giving that, the new cases. We're constantly looking at new ways we can look at the data and provide that to you in different ways, which is why we updated most recently looking at by week what our cases are. That gives us a more accurate depiction of where we are. Just so you know, we get our information from the state surveillance system. Providers report to the state health department and we get that information. The numbers can change because we're in the middle of a pandemic and information is constantly updating. They're doing data cleanup, and so it's important that we get this information out to you and make it as accurate as possible. some people have been asking us questions about recoveries. You know, they want to hear positive news. They want to know, you know, how many people are recovering. And there have been some challenges with reporting recoveries. You know, there's not a standard definition of it, of a recovery. There's a range of symptoms and severity for people who have the illness. And we don't have a good way of collecting that data either. And so that's something that we're aware of, we're thinking about, but at this time we don't have a good mechanism to really report that. You know, as we've said, this is a brand new illness and we're learning new things, you know, all the time. Wanted to, you know, let you know that our sanitarians are out there inspecting businesses to ensure compliance with the executive orders. We're looking at, you know, how our establishments and grocery stores and facilities, making sure that they're protecting the public and their employees. And so we've been working on, you know, going out and doing those inspections. We also wanted to remind people to follow the guidelines from the EPA, the Environmental Protection Agency, and the CDC on how to properly clean and use cleaning products and disinfectants. The CDC reported an increased amount of calls, poison control calls related to cleaning products, and we know there's misinformation about them. So we just want to remind everyone, please do not ingest these products. Don't apply them to food yourself or others. Follow the guidelines so you can stay safe and your family members can stay safe. We also want to remind people to wear face coverings when they're out in public, because this is a way to protect other people. The reason why the CDC is recommending that people wear face coverings in public is because asymptomatic people can transmit the virus unknowingly. And so if someone is asymptomatic and they talk near somebody, they could transmit that and someone could become infected. So it's another tool in the toolbox. We keep looking at, you know, what's available for the public and how can we, you know, reduce the burden of this illness on the community. And so cloth face coverings are one tool that we can use to limit the transmission of this virus. And so we're asking people to please wear them when they're in public. Still continue to follow that physical distancing, still stay 6 feet away, but it's important to wear these face coverings over your nose and your mouth so that you're protecting others. And also it's important to remember to, before you put on a face covering, to wash your hands or to use hand sanitizer, to avoid, you know, touching the mask or the covering while you have it on, you know. Also wash your hands before you take off that mask, and then make sure you're cleaning it thoroughly between uses. And so we do have information on our website that we can, you know, continue to share with people if they want to know more about the face cloth, the cloth face coverings. So those are most of the highlights I wanted to cover, Mayor.
One thing I want to mention also, we know that last week at the council meeting, the council voted to delay the collection of taxes until October 1st. Normally you have until, well, they're due July 1st, but you have until August 1st to pay without penalty. It is now pushed back to October 1st, knowing that people are out of work and people are challenged financially. And we wanted to make a process where people could delay paying their taxes until that time. We will be having a collection system where you can pay taxes online, you can pay taxes over the telephone, and at one point very soon we'll have a drive-up window at City Hall where you can perhaps pay taxes through your credit card that way. But the council did delay the tax collection until October 1st. So I wanted to make you aware of that. The health and safety of our community is utmost importance to me, and when we think of the current situation, excuse me. When we think of the current situation, we think of the safety of the community. We might not be thinking of digital safety. Cyber criminals are at it again in large force. They are sending fake emails saying things like they have hand sanitizer in stock, hand sanitizers in stock, and when you open the website, it gives you your device a virus, or when you buy the product, your credit card information is stolen. So please, especially now, be careful. We know that a lot of people are financially strapped, and you certainly can't afford to have your identity stolen, or you can't have your credit card used inappropriately or illegally. Continue to be mindful, extra vigilant. The criminals are looking to exploit this pandemic for personal gain. Unfortunately, we have people that do that, and we see this all the time when we have some sort of a crisis, such as 9/11 and other times. We've seen an increase in the kinds of things that people are trying to do. We also know that businesses have been impacted and hundreds of thousands of Connecticut residents have filed for unemployment. This is a situation that nobody anticipated, but the state of Connecticut is working hard to try to help people as much as they possibly can. The lost income has put a strain on local social services, especially food banks, and we're going to be talking about that. It's important to know that there are many people in the city of Norwalk who are going without food. They don't have the financial means when things are good. Now it's even more difficult for them to obtain food for their families. And I'm happy to have Lamont Daniels here, my Chief of Community Services, who will explain some of the things the city of Norwalk is trying to do and how you can help out. Lamont?
Thank you, Mayor, and good evening, Norwalk. I'm glad to be here today. So I just want to share with you what the city has embarked upon as it relates to the services that the mayor has mentioned. Like many other municipalities, we too are looking to be creative, and we're relying on many of you, that those that have means, to help support us and think how we can support our most vulnerable. I know that many residents are finding themselves in a position where they too are now asking for help. And I want to let you know tonight that there is help, and we're working to meet the needs, identify the needs, and deliver on those needs. So I'll start by saying thank you to all the local nonprofits and the service providers, and also the groups that are popping up asking, how can I help? So I just want to lay out kind of what's happening in the city. If you don't know, I will encourage you to always look on the city's website, norwalkct.org/city news. We have a team working diligently to keep that updated. So when in doubt, refer to our website to get the most current news. So we're partnering with our school district. Most recently, they were successfully opening up the Columbus Magnet School. So now in our city, we have 11 sites that are distributing free food to our residents. And I want to make it clear to our residents, you do not have to go to the school that you regularly attend. I'm encouraging you to go to the nearest school or the nearest community site to get food. As long as your child is under 18 years old, and we're including our preschoolers, please go to these food sites and get food. All you have to do is say how many are in your home. You do not need to bring your children with you. The mayor indicated our food banks and pantries. We do know, and we heard of the story that happened in Danbury, that when the Connecticut Food Bank served there, they ran out in 20 minutes. And so we are currently working with our local food pantries and food banks here locally in our city. And we are in constant contact with food suppliers to bring food in our city. Many have asked, I want to help, how can I help? So I'm going to ask, if you want to help, would you consider your local food pantry? There are both large organizations, and I don't want to start naming many and forgetting some. But again, look on our website. There are both our large food pantries and our local food pantries. Some of our churches and our smaller organizations, they are all in need of help. So if you so kindly would consider making a contribution or donation to our food pantries, both food goods and or monetary donations will help. They're often finding themselves that they too have to buy food at the market price, which also doesn't help because they're unable to buy at the discount prices because of the low food supply. We are hearing that the food bank will be getting food, but we may not see that until June or July. So we want to help and support our food pantries now. So for those who are looking to donate or provide food, please consider your food pantries. I also want to share that our office, we are in constant contact with our local providers. So there is a Friday call that we hold. And if you are a provider that is listening or work for a nonprofit, I want to invite your organization to that call. We also use that opportunity to have updates, but also to learn the needs. I want to thank everyone that's participating and also feeding us information, where's those needs and gaps. And as we learn about those needs and gaps, we pull together a variety of groups so we can identify what's the best way to help. We don't want to leave any resident, any Norwalker without food. So I'm also relying on you to help us identify if the food is not getting into those neighborhoods or communities. Please let us know so we can identify the best strategy to help our residents. I also want to lift up today, if you are interested in volunteering, we now have online, there is a volunteer survey that if you're willing and able to volunteer, will you kindly identify yourself by using our online portal? We have a volunteer team that will be able to assist you and match you to a real need. While we have many folks identifying wanting to volunteer, we are able to match you with a reputable organization so that we can meet the immediate needs that we're finding. And then also, if you are a nonprofit organization, we want to encourage you that if you have not yet submitted your survey to the city, we want you to do so. We now have a new feature, and this is both for our nonprofits and our residents, that you are now able to categorize that. If you're looking for food, you can now filter that. Or if you're a volunteer looking for a volunteer opportunity, you can now filter that. Or if you want to make a donation, you can now filter that online. And again, that's on our city website, and there's a list of our organizations. And lastly, I just want to elevate, there are many, you're probably hearing these terms called the warm line. So what is the warm line? Well, the warm line are dedicated phone lines that are operating in our city to assist our community. We have a senior warm line. And so I just want to give those numbers out very quickly, but again, you can find that on our website. So for our seniors, we know that many of you cannot go out. Many of you don't have the resources. And we are fortunate to have two great organizations that have now for quite some time operated senior warm lines where seniors can call, whether you want to whether to just say, hey, I want to talk to someone, we will give you a call back and check on you and say how you're doing, or you're in need of groceries. We have received an extended grant, and so we are able to expand our groceries door to door to our seniors. And so the Senior Center and the Senior Services Coordinating Council is both operating warm lines and groceries to our seniors age 60 and older. And those numbers are 203-847-3117, and in Spanish, 203-299-1500. And again, you can find us online. And we also have two additional numbers for our seniors, 203-434-3085 or 203-434-1876. For our teenagers, there's also hope for you. If you want to talk to someone, we're encouraging you to call 1-855-6-HOPE-NOW. That's a dedicated line for our young people, just to have someone check in while you're home. We recognize that this can be a lot for some folks, and we want to ensure you that we also understand and want to support your well-being during this time. And then lastly, the state of Connecticut just recently launched for parents. I'm a dad of a 6-year-old. Every now I need a break, I need to talk to someone. And so there's a resource for you. And that number is 1-833-258-5011, or you can visit talkitoutct.com. These are just resources to talk to someone and just say, hey, I want to talk to someone. Hey, I just need to hear another voice. And then lastly, we still have our 211 line, and we're encouraging residents, or if you know someone that is helping someone, would you please provide that hotline number, that care line number, 211, and they will connect them to the services in Norwalk. We're here with you, and we're here supporting you. And so however we can support you, please utilize those numbers, but also keep us informed as we work stronger together to support our community. Thank you, Mayor.
Thank you, Lamont. As you can see, the City of Norwalk, in partnership with our nonprofits and others, volunteers, are trying to provide as many services during this very difficult time as we possibly can. I've got a wonderful team in place working hard every day on your behalf, trying to help in any way that we possibly can. If there is a unique need, something that you don't know where to find the information, just feel free to reach out to one of us. You have my email, which is hrilling@norwalkt.org. Deanna Diamore is diamore@norwalkt.org, and Lamont Daniels is ldaniels@norwalkt.org. And you can also reach out to my Chief of Staff, Alicia King, at lking@norwalkct.org. We're here to listen to you. We're here to try to help you in any way that we possibly can. Sometimes things are needed out there that perhaps we don't know about, but we do want to know. So now we're going to start answering some of the questions. I have several questions up. We'll try to get to all of them. Remember to hit the Q&A button at the bottom of your screen. And we'll start off. Patrick asked about, I saw online there's a lack of food in Norwalk. Is this true? I believe Lamont Daniels has answered that question. So we'll move on to the next one. We have Dimitri asking that Mayor Rilling, well, once the heights in Fairfield County, our numbers are dropping dramatically. Stanford has surpassed us. How is this possible? I will pass this over to Deanna regarding some of the documented cases and how there was a lag in reporting some of the cases and why perhaps we might have been first at the very beginning. We had the largest numbers, and then afterwards other communities, and unfortunately other communities caught up and surpassed us. So Deanna? Sure,
Mayor. So if you remember, in the beginning when we first started reporting the cases, a lot of it was based on just getting the testing going and getting it up and running. We knew that there was going to be a town in Fairfield County that had the highest case counts because of, we're part of the New York metropolitan area. And so in terms of, other cities surpassing us, it's hard to compare, jurisdiction to jurisdiction, but we know that in Norwalk, we did see an increased amount of cases reported to us last week. So we've seen an increase, so we're about 1,500 right now. But in terms of, other cities, what's going on in other towns, it's really hard to compare why certain things are occurring over others. But we just need to keep following the physical distancing, the personal protection, washing your hands, not limiting the time out, only going out for essential errands, needing to get food. So that's really, we continue to monitor the cases to get an idea of what's going on in the community, but we are seeing a downward trend right now, and we're hoping that we are past that peak.
Thank you, Deanna. And while we are seeing a downward trend, again, I want to caution everybody, it's too early to tell exactly how much longer we're going to have some of these protocols and restrictions in place. The last thing I want to do is take our foot off the gas at this particular point and have us move backwards and see a second wave worse than the first. Nikki had asked what the health director can tell us about the number of cases. I believe Ms. D'Amore has answered that question. Anthony is asking, what does the new normal look like? Anthony, I wish I could tell. I don't think any of us has an idea of what's the new normal going to be. Obviously, we want to make sure that we don't let our guard down. We want to make sure that we also always practice good social distancing if we have to. We want to make sure that we keep our hands clean, and if there is a second wave. But I can imagine, I've seen some of the comments that people say that they would never go back to the kinds of things that we were used to, just being out in public without protocols. I don't see us wearing masks forever. I do believe that there will be some cautionary things that people will be doing rather than being out in public and being in large crowds. People may be reluctant to do that. I think it'll take a little while before people feel comfortable going into the stores with large amounts of people and large crowds. But I want to make sure that the stores do continue to do the things that they need to do. So it's a good question, but a difficult one to answer at this particular point. I don't know if Lamont or Deanna have any comment on that question, or if they feel that they want to add something to that.
I want to add that, it's going to be a slow transition. It's the new normal will involve, thinking about the practices that we're putting in place to protect the essential businesses right now, and how we can put those practices in place in other businesses that are going to reopen. Thinking about really being aware of symptoms and hoping that the testing capacity and the availability increases so that if you're not feeling well, you might not have a fever, you might not have a cough yet, but being able to get tested really quickly so we can identify who is sick and who needs to stay home. So it's looking at, what are our resources too in place so that we can continue, to stay on top of this moving forward.
Thank you, Deanna. Teresa asked a question, Mayor, what has been the most difficult part of this crisis for you? The most difficult part is when we have to impose restrictions on people's freedoms of movement, closing down businesses that interrupt people's livelihood. That's been the most difficult part. Nobody really wants to have to do those kinds of things, but I look at the greatest responsibility I have is protection of my community and making sure that we're safe. And so while those decisions were difficult, I knew they had to be made, and it was important to make them quickly. It was important to make them in a timely fashion so that we could slow the spread of this virus as quickly as we possibly could. That for me has been the most difficult challenge. I don't know if Deanna or Lamont would like to add anything to that.
Yeah, absolutely. It's knowing the sacrifices that people have to make in order to see these cases go down, in order to save lives. That's been the most difficult thing.
Thank you, Mayor. I think I would just add from a social service perspective, there are many people finding themselves in a position where they never had to ask for help. And we want to be able to be there and with dignity serve our residents. We are aware, and I have met families with children who were impacted because of their loss of jobs. So I think from a social service perspective, one of the most difficult is seeing families, seek help, and we're working very diligently to be able to be that support system to them and helping them understand where do you go for help. So from that perspective, it's difficult. Meeting people and hearing their stories, because we're hearing a lot of stories now of how this is impacting families.
Thank you. And it's really difficult because virtually every day, I have to announce another death or more in the city of Norwalk. These are more than just numbers. I know we said there's 70 people have lost their lives in the city of Norwalk, but these are husbands, wives, fathers, mothers, children, close friends. And it's really a challenge when we start to think we've lost so many people. So in addition to making those difficult decisions, having to announce and having to deal with the loss of life in our community, people that have lived here, many of them all their lives, people who engaged in many different activities in the city of Norwalk, volunteering their services and so forth. It's just a very difficult thing. Barbara asks, is there a way to make your own mask? Deanna, if you want to answer that, there is, and we have some information up. So Deanna.
Sure. Yes, we do have information on our website. I can get you the link to it right now, just so it's norwalkct.org/coronavirus. We have a flyer about how to use cloth masks or face coverings and how to make them. And we also have a link to the CDC's website where they have a flyer, and there's also a video that we have posted by the U.S. Surgeon General. So that information is on our website. And if you're unable to find it, please email me, ddamore@norwalkct.org, and I can send you that information.
Thank you, Deanna. We want to remind people that the mask or the face coverings have limited efficacy. They are there to mainly stop you from spreading if you're asymptomatic and you perhaps do have the virus, but the masks are limited into what they can do. So they might not necessarily stop you from getting the virus, but we just want to know that, make sure that you don't have a false sense of security and let your guard down when you're wearing a face covering. A nice little note from Steve here, who said, I just want to say thank you for all you're doing. Steve, thank you. Thank you for being a responsible citizen for what you're doing. I know that I have a wonderful team in place. Everybody is helping out. They're professional, they're experienced, and we're doing everything that we possibly can to keep the city safe. And actually, we're happy to be in a position of being able to do this. So thank you for your nice words. Patrick is asking, do you think the virus will come back in the fall or winter? Well, if some of the medical professionals are saying that it will. Some are saying that it could be a second wave or a third wave. Some people are saying that it could be an annual event. Hopefully, the medical professionals in the medical field, they're working on finding a virus and hopefully, finding a vaccine, and hopefully they'll be able to find one soon. Deanna or Lamont, do you want to add to that regarding some of the professionals that are speaking about that possibility?
No, I think you covered it great, Mayor. We're hearing from some that we could expect to see another wave, but at this point, we don't know for sure. But we are looking at ways to build a public health system, improving, staffing for contact tracing, building software to make us improve the testing. They're looking a lot into that to prepare in case we do see more cases in the future.
Thank you, Deanna. Let's see. Patricia asks, is the worst of this over? We are in a downward trend. We're seeing fewer hospitalizations. There's a bit of a lag relative to some of the cases that are being reported. And I know people ask about the people that are recovering from the COVID-19. The good news is most people do end up recovering. The bad part of that is that perhaps there's some permanent physical damage that they're experiencing, whether it be respiratory or other. But it's hard to tell if the worst is over. That's why we're being very cautious on how we decide to ease some of the restrictions. We want to make sure that we're on a significant downward trend and that we can feel that we've sufficiently slowed the spread of the virus. Deanna or Lamont, you want to chime in on that? Is certainly.
You answered that perfectly, Mayor. Yeah. I mean, it's a whole community effort too. So, it really takes the whole community to keep this downward trend going.
Just add to, I think it's important too for parents or friends of young people. I'm encouraging you to keep talking about it with your children so they understand the importance of this, because I have a 6-year-old and we're talking to her about it. And if you have a teenager, because we're also relying on them to take this serious so they're not passing it, because they can get the coronavirus. It may look different in a teenage body, but if they are passing it along, what we do know is that it can impact the older adults, especially if they have existing medical issues. So my message is, talk about it as a family so that we all can see the trend continue to decrease, so that we can get back to what this new normal that we all have to kind of redefine. Thank you, Mayor.
Thank you. I want to remind anybody that may have tuned in late that there's a Q&A button at the bottom of your computer, at the bottom of your screen. So if you want to ask a question, you want to type in a question, that's how you do it, by hitting that Q&A button. John Turner asks when the town will make a decision about summer camps. We're trying to hold off on making that decision as long as we possibly can. We are doing the things necessary to arrange for summer camps by getting staff on board and so forth. It's going to be a challenge because we know people that might be going back to work and they're going to need a place to send their children during the day. So we are working on this. We're keeping this on the front burner to make sure that we do it right. We're working with our Recreation and Parks and with our Department of Public Works, so where the Recreation and Parks Department comes under, to make sure that we're doing everything we possibly can. We want to make sure that we do have summer camps, but again, it's going to be situational. It's going to depend on where we are at any given time. But keep rest assured that we're doing everything we possibly can to be able to have summer camps, because we know people are going to need a place to send their children. We know that the children want to get outside. We want to know that we want them to have good, healthy summer activities. So we're doing what we can. Josh is asking, how is the city working with other cities? Fairfield County got hit the hardest, so I hope everyone is working together down here. We are constantly on line with other mayors in other cities. We're constantly in discussions with our state and local representatives, the state senators, the state representatives for the city of Norwalk. We are meeting with mayors from the city of Stamford, with the city of Bridgeport, with New Haven and Hartford. We constantly share ideas, share thoughts, where we are at any given time, how we can work together, how we can coordinate, how we can seek more help and information from the state of Connecticut and from our federal government. Frequently, Senator Murphy, Senator Blumenthal, Representative Himes for the 4th District will call me on the phone, and we'll talk about issues, how the federal government can be more responsive and provide us with the things that we need. Grants, FEMA reimbursements, we're documenting all our expenses to make sure that whatever we're able to get reimbursed for through FEMA, that we'll have the information ready, we'll have the documentation in place so that we'll be ready to go when those reimbursements become available. So we are constantly working with all the surrounding mayors and our state and local representatives as far as our federal delegation. So
Mayor, can I just add to that quickly? Just say that the health departments, the health directors are in close contact with each other. We're constantly sharing best practices and strategies amongst ourselves. So we're working very closely with one another.
Okay. Emily Elizabeth, knowing what we know now, is there something you wish you could have done differently? Yeah, I wish I could have developed a vaccine, but unfortunately, that's not my area of expertise. You know, it's been a challenge. We can always look back in retrospect and say, what could have been done differently? We're operating on a daily basis with information that we have in front of us. And as you know, you indicate knowing what we know now. Knowing what we know now is not what we knew at the very beginning of this. So we have to do everything that we possibly can to go with the information that we have at any given time. It's a challenge. It was very difficult for me to make the decision to close down barbershops and beauty salons and nail parlors. These impact people's lives, their livelihood. But it was a decision that we had to make. We're constantly looking for personal protection equipment, more face coverings, more masks, the things that we need to make sure that we work to give people the things that they need. So done differently, I think we've done really well. I think in speaking with other communities, we're sharing information. We're all doing things in a similar fashion. Some are doing things a little bit differently, but things that I could have done differently, I think you could always look in hindsight and figure out something, but I think we're moving forward with the information that we have at any given time. I don't know if Deanna or Lamont, do you want to chime in?
I'm sure as we as we move forward, we're going to be doing that analysis. We're going to be looking at, what were our strengths, weaknesses, opportunities, what could we have done differently? Haven't had the opportunity to do that thorough analysis yet, but that is something that we will be doing, as part of our continuous improvement. But I will say, I think communication is really key in being able to talk to our partners, talk to the different departments, and the mayor has done such a great job in setting up that communication, those mechanisms, so that we're in constant contact, and so we can continually evolve as the situation evolves. So that's been one lesson that I've learned in the past, is just constantly open that communication. I think that's something that we've done since the beginning, internally, and we've been always been trying to push out communication and messages to the public as well.
Okay, now the next question, I'm not sure I totally understand it, but if Mr. Ted Rawson would like to email me for expounding upon it, I certainly would try to answer. The answer is, are you social distancing from space? I don't know, that's because of my background on the screen here. And why are your underlings at the beach when it's closed? That I don't know to what you might be referring, Mr. Rawson. So if you'd like to email me directly, I'd be more than happy to discuss that with you. Next question from Jack. Do I need to wear a mask when I'm walking my dog? Remember, the mask or the face covering from the order of the governor is if you're out in public and if you cannot if you can't socially distance, if you're going to be in with people, you need to wear a mask. So I'm not sure it's necessary to wear a mask when you're out walking the dog unless you're with other people and you can't keep your distance from them. Deanna Lamond. Okay.
Yeah, no, nothing to
Um,
add.
should kids under 2 wear a mask? See conflicting info when out walking, and kids under 10 when playing outside. Again, Deanna, maybe you can just expound upon that.
Yeah, we're not recommending that children under 2 wear a mask or a covering. Yeah, that, you know, the CDC does not recommend that children under the age of 2 have a cloth face covering on.
And Eduardo said that the masks are extremely important. If you could possibly emphasize the use of the mask. I think we've done that. We want to make sure that people wear face coverings whenever they're out in public and they can't exercise physical distancing. Eduardo says, thank you. Andre said, I don't know who can answer this question, but my question is, what is being done about how to protect each other's social distance? For example, Brookside Elementary School, people hang out in the school and play baseball when can't the police do multiple checks? They are not supposed to be playing baseball. If somebody sees them playing sports on a city piece of property, whether it's basketball, lacrosse, soccer, baseball, you simply need to call the police department because the school properties and are closed to the public, and the school playground equipment should not be being used, and there should be no groups gathering there and playing sports. So the question that the way to handle that is to simply call the police department and they will send somebody over. The mask is very good to stop the virus, so thank you. Jack, thank you for doing this. It's Norwalk, Nick asks if the Norwalk Hospital is Norwalk Hospital only accepting COVID-19 patients. If someone needs care but doesn't require 911 attention, what do we do? Deanna or Lamont, you want to answer that? The answer basically is no, but go ahead.
Yeah, please do. Please continue to seek care at Norwalk Hospital if you need care, or any hospital. They're not just accepting COVID patients; they're accepting all patients. So it's important that you call your medical provider. If you have an emergency, please call 911 if you need to. Don't hesitate to seek medical care if you need it.
Mhm.
Okay, I'm going to answer, I think, 2 more questions I see on my screen. I know I'm not able to get to everybody, and I do want to thank everybody. We are going to be doing this next Monday as well. I want to remind you that if I haven't gotten to your questions, please email me at hrilling@norwalkct.org. Any questions I was not able to answer tonight, and I will get to that. Mr. Rawson, thank you. He said, thank you for all you're doing. The next one, LCR. Good evening, Mayor. Are you or others working to get food resources for the low wagers, undocumented residents, at-risk community members? I think Mr. Daniels, if you want to just touch on that real quickly. I know my wife is also working with Mr. Daniels and others. We've got some things where we're going to be bringing food into Norwalk, hopefully very soon, but go ahead.
Yes, thank you, Mayor. Just quickly, for the sake of time, my email address again is ldaniels@norwalkct.org. We're also asking that if you see a need or a gap of services, please let us know. But to your question, we certainly are. There is a group actually that is already formed. First Lady Rilling is also help spearheading this project so we can get food to all residents of Norwalk.
Thank you. Samantha asks, how we unwind or relax? This is so stressful. It is, and at night I relax and unwind by going to sleep and waking up energized and ready to go. And the last question I'll ask, because it's getting to be a time when I have to jump onto another Zoom meeting. Heather asks, can the beach be open, but at the same time prevent large gatherings? Heather, we're doing all we can to try to open the beach and parks as quickly as we possibly can. We know with warm weather, people want to get out and walk. The bottom line on this issue is when these do happen, if the public will practice responsible social distancing, wear their masks until the time when the governor said that they're no longer necessary. There was a beach, I mentioned earlier at the beginning that there was a beach in California that they opened because they felt people needed to be out, and 40,000 people showed up and they had to close it again. So we want people to be responsible. I know people want to get out. Our beach is a beautiful, beautiful place. We're very proud of it. So we're going to do everything we can to open our beach and other public facilities as quickly as we can. So again, I want to thank everybody for joining us tonight. Next week, we will be doing the same, but please do not hesitate to reach out to me or my staff in the event you have any questions whatsoever. We'll do everything we can to get you the answer and to get it quickly. So again, everybody, thank you. I want to thank Lamond Daniels. I want to thank Deanna Diamore for joining me tonight. I want to thank all the Norwalk residents who logged on to watch and to get information. And I want to thank my staff. I want to thank our first responders, our men and women on the fire department and police department, our emergency dispatch, but the grocery workers, the food service workers, all the people, the pharmacy workers that are out there, all the people that are out there on the front lines while this is going on. They are the true heroes and the true sheroes of this COVID-19 virus. We will get through this. We will get through this together. And I always like to end by saying Norwalk strong. Thank you.